If you or a loved one are preparing for cataract surgery, you've probably been told that it's one of the safest and most common procedures in the world. And that is true. But what often gets lost in the busy preoperative consultation is the full, unvarnished truth about the recovery process. I'm a board-certified ophthalmologist, and today I'm here to give you the straight talk. No sugarcoating, no fluff, just the facts. The journey after your surgery can be filled with strange, annoying, and sometimes frightening surprises that can make you question if something has gone wrong. But in most cases, these are a completely normal part of the healing journey. Today, I'm going to walk you through the 7 shocking truths about cataract surgery recovery that you need to know. My goal is to empower you with knowledge so that nothing catches you off guard, and you can navigate your recovery with confidence and peace of mind. The 7 shocking truths of recovery. Truth number 1, your vision will get worse before it gets better. This is the first and most important expectation to set. You will not sit up from the operating table with crystal clear, perfect 20/20 vision. In fact, for the first few days, and sometimes even for a week or two, your vision is likely to be blurry, hazy, or foggy. This is not a sign of failure. It is a sign of healing. This blurriness is primarily due to corneal edema, which is a temporary swelling of the cornea, the clear front window of your eye. The surgery, though gentle, is still a trauma to the eye, and the tissue responds by swelling. Think of it like a sprained ankle. It gets swollen and puffy before it gets better. Additionally, the pupil of your operated eye will likely be dilated for a day or two from the drops used during surgery. A dilated pupil cannot focus properly, especially up close, which adds to the blur. So, do not panic. Your eye is simply adjusting to a monumental change. The cloudy, yellowed lens that has been dimming your world for years is gone, and a new, perfectly clear artificial lens is in its place. This initial blurriness is a normal and temporary part of that incredible transition. Truth number 2, your eye will feel like a sandy beach. Your eye just had surgery, and it's going to complain a little bit. One of the most common complaints is a gritty, sandy, or scratchy feeling, as if there's an eyelash or a grain of sand stuck in your eye that you just can't get out. This happens because the small incisions made during the procedure, though self-sealing, can temporarily disrupt the smooth surface of your eye and your delicate tear film. Dry eye after cataract surgery is extremely common. A study published in the journal Cornea found that a significant majority of patients experience mild to moderate dry eye symptoms after the operation. So, if your eye feels dry, itchy, and irritated, you are in good company. The absolute worst thing you can do is rub it. Rubbing your eye in the first few weeks after surgery can disrupt the healing incision, introduce bacteria, and dramatically increase your risk of a serious infection. The solution is twofold. First, diligently use the anti-inflammatory and antibiotic drops prescribed by your surgeon. They are crucial for controlling the inflammation that can worsen dry eye. Second, ask your surgeon about using preservative-free artificial tears. These can provide immense relief. But remember, the gritty feeling is a normal part of the surface healing, and it will get better. Truth number 3, you will taste your eye drops. This is one of the strangest and most surprising side effects for patients. A few minutes after putting your prescribed drops in your eye, you may experience a bitter chemical taste in the back of your throat. Yes, you can literally taste your eye drops. This is not your imagination, and it's not a sign that something is wrong. It's simple anatomy. There is a tiny drainage system in the inner corner of your eyelids called the nasolacrimal duct. Its job is to drain your tears away from your eye and into your nasal passage. From there, the fluid drains down the back of your throat. When you put in an eye drop, that medicated fluid follows the same pathway. It's a completely harmless, but often unpleasant experience. To lessen this effect, you can use a simple technique called punctal occlusion. Immediately after instilling a drop, use your index finger to apply gentle pressure to the inner corner of your eye, right next to your nose. Hold that pressure for a full minute. This temporarily closes off that drainage duct, which not only prevents the bitter taste, but also keeps the medication on the surface of your eye for longer, increasing its effectiveness. Truth number 4. The world will seem too bright and too blue. This is a fascinating and often jarring experience. For years, as your cataract developed, it acted like a yellow-brown filter over your vision, dimming colors and reducing the amount of light entering your eye. You became accustomed to seeing the world through this sepia-toned lens. The moment that cataract is removed, it's like turning on a bright light in a dark room. Patients are often shocked at how vivid and bright the world appears. Whites will seem brilliant, and you will notice a distinct bluish tint to many things. This phenomenon is a form of chromatopsia, or altered color vision, and it's completely normal. Your brain is simply being flooded with the blue light that your cataract has been blocking for years. This also leads to significant light sensitivity, or photophobia. Bright sunlight can feel almost painful at first, and indoor lighting can seem harsh and glaring. The solution is simple. High-quality sunglasses are your new best friend. Wear them religiously whenever you are outdoors for the first few weeks, even on cloudy days. You may even find it more comfortable to wear them indoors for a while, or to dim the lights in your home. This intense brightness and blue tint will gradually fade over a few weeks as your brain adapts and recalibrates to your new, clearer view of the world. Truth number 5. Your brain will feel dizzy and confused. This is a critically important surprise to understand, especially in the period between your first and second eye surgeries. Your brain is a master of creating a single, seamless, three-dimensional image from the two slightly different pictures it receives from your eyes. This is called binocular vision. But what happens when one eye suddenly sees the world with crystal clarity and vibrant color through a new lens, while the other eye is still seeing a blurry, yellowed image through a cataract? Your brain gets confused. It struggles to fuse these two dramatically different images into one coherent picture. This can result in a temporary loss of depth perception. You might find yourself misjudging the height of a curb, overpouring a glass of water, or feeling generally disoriented. It's like your brain is trying to watch two different movies at the same time. This is especially noticeable if you have a high prescription in your glasses. Your old glasses will no longer work for the operated eye, creating an even greater imbalance. A practical tip is to ask your optician to pop the lens out of your old glasses on the side of the surgery. It may look odd, but it can be far more comfortable than having one clear eye and one blurry, distorted eye. The good news is that this strange, wonky feeling is temporary. Once your second eye has its surgery, your brain will rejoice at having two clear images to work with again, and your depth perception will be restored, often better than it was before. Truth number 6. You will likely still need reading glasses. This is perhaps the biggest and most common misconception about cataract surgery. Many patients believe that the surgery is a magic fix that will eliminate their need for glasses forever. The blunt reality is that for the vast majority of patients who receive a standard monofocal lens implant, you will still need reading glasses for up-close work. Here's why. Your natural lens when you are young is flexible. It can change its shape to focus on objects at different distances, a process called accommodation. The standard artificial lens that is implanted during cataract surgery is a fixed monofocal lens. It cannot change its shape. It can be set to give you excellent distance vision, but it simply cannot focus up close. This is not a complication. It is a feature of the lens technology. A week after your surgery, when you notice you still can't read your phone or a menu without glasses, that is completely expected. Once your eye has fully healed, usually after a few weeks, you can be prescribed a new, simple pair of reading glasses that will make up-close tasks comfortable again. While there are premium, multifocal lens options that can reduce the need for reading glasses, they are not suitable for everyone and can come with their own set of compromises, like more glare and halos. Truth number 7. The cataract can come back, sort of. Months or even years after a perfectly successful cataract surgery, some patients will notice their vision becoming cloudy or blurry again, almost as if the cataract is returning. This can be frightening, but it is not a new cataract. It is a very common and easily treatable condition called posterior capsular opacification, or PCO. To understand this, you need to know a bit about the surgery. The artificial lens is not just placed freely inside your eye. It is placed inside the natural microscopic bag or capsule that used to hold your old lens. In up to 20 to 40% of patients, this clear, cellophane-like back wall of the capsule can become hazy over time, as old lens cells migrate across it. The good news is that the fix is incredibly simple. It involves a quick, painless, in-office laser procedure called a YAG laser capsulotomy. The laser is used to create a small, clean opening in the center of that hazy capsule, allowing light to pass through clearly again. The procedure takes only a few minutes. There are no incisions, and the visual clarity is usually restored almost immediately. So if a fog creeps back into your vision down the road, don't assume the worst. It's likely just a secondary cataract, and it is easily fixed. The red flags: when to actually panic. I've spent this time reassuring you about what's normal. Now I need to be very clear about what is not normal. While serious complications are very rare, they can happen, and catching them early is the key to saving your sight. First, increasing pain. Mild scratchiness is normal. Severe, deep, aching pain is not normal. It could be a sign of high pressure inside the eye or a serious infection. Second, worsening vision. Your vision should get progressively clearer each day. If your vision is getting worse instead of better, that is a red flag. Third, significant discharge. A little watering is normal. A thick yellow or green discharge is a sign of infection. And fourth, new floaters or flashes of light. A sudden shower of new floaters, flashes of light, or a curtain-like shadow in your vision are possible signs of a retinal detachment. If you experience any of these symptoms, do not wait for your scheduled follow-up. Call your surgeon's emergency number immediately. It is always better to have a false alarm than to miss a real, sight-threatening problem. Cataract surgery is a truly life-changing procedure, but the recovery is a process, not an instant fix. It comes with quirks and challenges that people don't always talk about. But now, you have the knowledge. You know what to expect. And that knowledge is the most powerful antidote to fear. Each of these annoying side effects is usually temporary or easily manageable. Your job is to be a good patient. Be patient with your body. Use your drops diligently. Protect your eye. And now, you know how to be a smart monitor of your own recovery, and you know when to sound the alarm. Thank you for watching. I hope this straightforward rundown helps you feel more in control and less anxious. Please give this video a like and share it with anyone you know who might be preparing for this journey. And now, I want to hear from you. What is the one surprise from this list that you are most glad to learn about? Share it in the comments below,